Hello, everyone. This is the MHI podcast. We're joined here by Onyx, Olympia, Glemmy, and myself, Mariah. I am a MHI Scholar, and this is another week of another podcast.
Hi, my name is Glammy. I'm a rising fourth year at New College of Florida. I'm going for my art major and my stat minor, and I work for graphics and communications for MHI, the Multicultural Health Institute.
Hi, my name is Olympia. I'm an MHI Scholar. I'm a recent grad from New College of Florida. I just got my bachelor's degree in computer science. And I've been working for MHI for the last 2 years doing data and presentations and public speaking events related to COVID and just generally social determinants of health and outreach. So today, we're going to be talking about an article. Let me just pull it up here so that I can cite everything correctly. So this article comes from Drs. David Scales, Jack Gorman, and Kathleen Jamieson. Two of them are out of an organization called Critica in Bronx, and also two of them are Kathleen, Dr. Jamieson, comes from the Annenberg Public Policy Center from the University of Pennsylvania. And this article is basically about trying to come up with new ways to address COVID misinformation. So first we have to define a couple of terms here. The first term that we're going to define is epidemiology, because that's going to get used a lot. So whenever you hear the word epidemiology, you can just think the study of how diseases spread, because that's what epidemiology is. And similarly, a term that I think was actually coined in this article is called infodemiology, which is the study of how misinformation spreads. So this whole article is essentially using epidemiological models, the models that we use to track the spread of infectious diseases, on misinformation to see if those same models and practices that we use to prevent the spread of infectious diseases can also be used to prevent the spread of infectious ideas, let's say, infectious misinformation. So there's a really interesting part in this article where they break down sort of an idea of how these tactics would work. So they talk first about the example of masking. They talk about all of the things that we know about masking in relation to COVID, how masking protects other people, about how the scientific consensus agrees that masking prevents or helps to prevent COVID-19 spread. And then they go into some categories of misinformation. This is what I feel like is really the most important part, because what we're doing is we're defining broad categories of misinformation that different types of claims can fall into, and then talking about how we can address those types of misinformation specifically. So for example, we have distortions of scientific findings, which would be when somebody takes a study, in this case about masks, and misinterprets it in some way, either intentionally or unintentionally. So their example would be a claim like a CDC study found that most mask wearers caught COVID-19. While that may be true, it's a distortion of what the actual scientific consensus is, which is that masks help to prevent the spread of COVID-19 to others. So they also have a couple examples up here of things that prove that this is not true. For example, two hairstylists who both had COVID-19 but didn't know that they had COVID-19 saw over 139 customers. Both the stylists and all the clients wore masks, and a CDC investigation found that no clients became ill, and that the 67 who agreed to testing showed no signs of infection. So in the case of like distortions of scientific findings, it's important to correct what the science actually found. Then we have a couple of other categories which can get a little bit trickier. For example, claims about the efficacy of mask wearing not being established, conspiracy theories about masks. Those are some of the hardest ones to sort of combat because they don't really come from, they're not like a distortion of real facts. They're sort of just out there. For example, like masks contain tracking devices for surveillance. That's kind of like proving a negative. That's like somebody saying, prove to me there isn't an elephant in this room right now. It's kind of difficult to prove something that's not true, right? Or prove that something is not true if there's no evidence that it even exists to begin with. So they talk in this article also about how, the different types of misinformation have to be addressed differently because they come from different places. They come from different like fundamental misunderstandings of underlying real facts. And also the part in this article that I really like is they talk about the social determinants of health and how just like we use the social determinants of health to determine how susceptible someone is to an infectious disease, we can also use the social determinants of health to determine how susceptible or how likely someone is to believe misinformation. So things like their information environment. So where do you get your information from? Your individual psychology, the way that you consume information. Like, do you consume information from the news? Do you consume information from social media? Things like that. All of those things play into how likely a person is to believe misinformation. And also, I just wanted to mention that generally a lot of the prevention methods that they outline in this article, they talk about a lot of things like getting on misinformation right when the first misinterpretation happens. So like right when the origin of that, untrue claim comes about, the first thing to do is to counteract it. However, that doesn't really work for the people who are super committed and dedicated to their misinformation and are sort of trapped in echo chambers. These are really more techniques for the people who are on the edge, who are thinking about this type of misinformation, who are, sort of mulling it over. They're skeptical. They're not really sure. Those are the people that we really want to get in contact with in order to prevent the spread of misinformation. So yeah, I just thought this was a really, really interesting article. It's interesting to me, obviously, because I'm a computer scientist and a lot of this misinformation gets spread over social media. And also one of the things that they recommend is increased algorithmic transparency among social media among social media organizations, which sounds like a lot of words, but really what it means is just we want social media companies to tell us how their software works. But that's really all it is. We just want them to tell us how it works. And that would help a lot in terms of, the people who are combating this misinformation being able to actually intervene at the point where it is most critical to intervene in this misinformation. And just like with epidemiology, just like with trying to prevent the spread of infectious disease, we want to get to those people who have not been infected yet. And sort of try to protect them from misinformation. So yeah, any thoughts, comments, questions? I imagine we'll have a lot to talk about with this article, even though it was kind of short, because it's also very interesting.
I agreed with everything you were saying, but I wanted to touch on a particular topic because I know when we think about misinformation being spread, we kind of like demonize the person who's spreading information, but I think it's important to also note that some of the information that's being spread is like might just be from mistaking something for something else, if that makes sense. So like not fully understanding the context of a sentence with it when someone says it to them, or not fully understanding the words that they're reading. Like the level of education it takes to fully understand a scientific article is super important. Because jargon could typically be used, and jargon is just bigger words that aren't commonly used that like make things more concise when speaking, but isn't really great for the like a general public, which is again something important to consider, because even while reading this article alone, like me and Olympia can attest to this, like we both had to look up words in order to
Mhm.
fully understand this entire article to its fullest and to really understand where it's coming from. And it's important to like consider that group of people who just simply don't get what's going on because it's not being fully explained to them in the best way, because some of the words that are being used are purposely being used to like cause misinformation, or like, you know, the level of inclusivity in language is super important, because again certain things could be mistranslated.
Mhm.
So that's a really big part of misinformation, especially when it comes to social media in particular, because people will take things out of context without knowing like what those words really mean. And that's really where all of this starts, because then people start using these arguments to justify their needs and wants. People don't just say crazy outlandish things because it doesn't justify something that they want. Like they do this for a reason. Like
Mhm.
people who make up things about mask having trackers or the vaccines having trackers in them probably are saying this because they don't want to do those things.
Mhm.
And like that was really big in the rhetoric that was spread. So it's really important to like point out there's like a level of like blissful ignorance when it comes to like medicine. It seems like people will do a basic Google search and think that they know it all, but they're
Mhm.
like getting things from Wikipedia, and Wikipedia could be changed at any time by anyone. So
Right. Yeah.
it's like really important to consider like not all of this is like coming from a bad place per se, but it's not all coming from an educated place, and I think that's what's super important to highlight.
Yeah.
Wait, one thing
Definitely.
about Wikipedia, I'm not going to take this line down, but Wikipedia is a good source to get like baseline information. But with whatever you're reading, if it doesn't sound right and if it doesn't have a source, then it's probably not correct. I think
Yeah.
it's like some people, I know some people. When I think of this, I think of my dad. He gets it from these like not correct news articles, which they don't upheld like journalistic integrity. And like
Hmm.
what Olympia said also with like algorithms supporting um that kind of false information too, which is really, really important. Anyways.
Yeah, and I think also I think definitely what Glemmy said is right. Like a lot of these scientific articles use jargon that makes sense in the medical community or is designed for the audience who's going to be reading them, but they don't consider how the news outlets are then going to take that information and may misinterpret it. So like one of the examples they gave in the article was about the idea that like the vaccine can kill you. So it was one of the things they mentioned was that after there was a famous baseball legend named Hank Aaron. If you don't know who he is, you should Google him. I think he was very, very famous baseball player. And I believe also one of the first Black baseball players. But among social media, his death was largely attributed to the fact that he got the vaccine. Um, which of course is not true. Just because something happens after something else doesn't mean the thing that came before it caused it, right? So like if I eat a banana and then I get in my car and I get in a car crash, it's not the banana that caused the car crash. But the when that initial story gets picked up, it then we sort of play a game of telephone where people pass that through different it gets passed through the different like layers, right? So like first it's just things that people are saying on Twitter, then the extreme fringe media outlets pick it up and start pushing it, then the more, the sort of less extreme media outlets pick it up and start pushing it, and that's where you start to really see traction in some of these crazy ideas where you look at them and you're like, what? How does that even happen? Because it sort of picks up traction as it goes, right? So it might have been
Right.
based on a real thing initially, but as it passes through the different vectors, if you want to call them that, the different people who are spreading it mutates just like a virus does. It changes, the details get removed or added in, and by the time that it gets to the mainstream, it's a completely different claim than what was initially being made. I think that's also a big part of it, and of course the algorithms are a massive part of it. They intentionally promote content that will get a reaction, whether it's a positive reaction
Right.
or a negative reaction. The algorithms, at least as far as we know, because like they point out in the study, we actually don't know very much about how these algorithms work, but at least as far as we know, they're designed to serve content that gets people to react. That which includes super outlandish, super ridiculous, obviously untrue content. But especially if you have like especially with older people, I find that they have a very difficult time parsing out what is real from what is fake on the internet. They have a very difficult time figuring out claims that are
Especially when
real
these
from
news
claims that are fake.
outlets
Yeah.
push the same stories, because
Yeah.
I think what people are starting to recognize, but not enough people are recognizing, is that although there's a level of integrity with journalism, right? But in regards to how the world is functioning, that it's functioning off of views. Views kind of works like money. Like the more views, the more likely that station is making more and whatnot. And so when they're promoting or these certain taglines of the conspiracy of whatever, people will probably ignore the conspiracy part and just focus on what they're actually promoting, is that people are spreading this story. And the thing is like these news outlets in general, I'm speaking, which is probably not the best way to, it's never good to generalize, but just for the sake of this discussion, um they'll push these narratives out there because they know it creates views, and that's what they need. They need eyes on their stuff. And the thing is, unfortunately, when people look at something, they don't look deeply enough either. So they'll just look at the tagline and then they'll go from there. And they'll be like, well, that's a news source, so of course they're going to be right. And some people have different preferences on certain news sources. So that's a whole different conversation as well. But it's also important to consider that traction you're speaking about, Olympia, is something that's highly that's people are motivated to go towards that because of just how the system is set up, which is really unfortunate. Because from our last week's conversation, or I believe it was, no, not last week's, I wasn't here last week, but the week before, when we were speaking to Ryan and we are speaking about healthcare, and we were speaking about the objective of healthcare, right? We ended up on the discussion that healthcare really revolves around money to a degree, not people's health. And just like that, when it comes to spreading information, it's not surrounded the idea of spreading facts. It's this idea of just creating traction and creating friction. So there is more conversation, whether it's good or bad. The idea is that there's no such thing as bad press. That's been a thing for the longest too. So it's really sad that people's health is used just to create a level of traction as opposed to actually help each other, if that makes any sense.
Yeah, definitely. Especially when you see that there are cases that we can track of people who have died due to COVID misinformation. There are videos, or there are examples of people who have very vocally supported some of these vaccine conspiracy theories, didn't get the vaccine, ended up getting COVID, and then ended up passing away, which is incredibly sad, not just for them, but also for their families. And I've seen a lot of interviews with the families of these types of people. And unfortunately, I have some people like this in my own family, who really just, even when they were at their sickest, they just did not believe that a vaccine would have saved them. Or even if they did, by that time, it was already too late. At that point, they're already in the hospital. They're already very sick. And a lot of the people who I think are the most susceptible to this misinformation are also the people who are the most at risk in terms of if they were to catch COVID, having a really bad outcome. You know, we're looking at the same general age group here of people who would have the absolute worst outcomes from COVID and people who are the most likely to fall for this kind of misinformation that we're talking about. So it really is a twin pandemic of both misinformation and an actual virus, which I think is why this article is written in such a way as to, you know, sort of combine the disciplines of the study of misinformation and the study of infectious diseases into one sort of cohesive group, because we need to study it increasingly in the future. We're going to need to monitor both at the same time in order to effectively prevent the spread of you know, whatever infectious disease, and therefore also prevent the spread of misinformation. So yeah, does anybody else have any comments or thoughts about the article or just the topic in general?
I personally like how this article is set up. I know we speak about the content of the article, but I think it's also important to recognize how articles are written and who they're written for. Um, Although this article includes a little bit of jargon, it's not too much, right? It's like a Google search away.
Yeah.
But the way they set up their discussion was really interesting because it was really easy to understand, which is important, right? Because if they wanted to spread this, they wanted to spread it to, you know, as general of an audience as possible. But that infographic that you were looking at earlier, that table, the order in which they put things is super important, right? Because they're essentially like stating where these fallacies are, the things that people have commonly spread. And as you mentioned, they like essentially put a solution onto how to stop that misinformation, but they also give really good examples as to what that information is.
Right.
Which really helps because not everybody's going to take a class on ethics and like philosophy and recognize what an argument is and like the importance of context, right? But like they make it really easy to understand. And I think that's the most important part, is the level of accessibility within this, right? And that, I think that's what this our whole article really like leads to in regards to a discussion, because the problem with misinformation is the level of accessibility to the facts and like things that make sense and things that don't just support someone's motive to not do something. You know what I'm saying? So I don't know. I thought that was really interesting because I feel like sometimes we talk about these topics and it's more, sometimes it's more important to even talk about like how they present these topics too, because you have to present it in the most objective way. There can't be any level of bias when writing these things, because if there is, then people will be like, well, that's an opinion, this is that and this, and like people confuse things.
Right, exactly.
So you know, that's important. And I think that's like, to those listening, like when you're reading an article or just looking at anything that has really important information, like take a step back and really recognize like, why are they using these type of words? Like, why are they like, is this meant for me? Like, is this article meant for me? And like, that's super important because every author has a certain target audience in mind. And it can't just be for everyone. So because you can't appease everyone, but you could like try to reach them at the very least.
Yeah. I also feel like it's important to try to, on the point of, to people who are listening, I feel like it's important for us to try to recognize these types of misinformation, whether it's COVID related or not, just as we sort of, you know, mill about on the internet as people do. Because a lot of these are, you know, they have big fancy names in Latin for the type of, you know, logical fallacy or whatever, but we really don't need to remember those because you can sort of spot them if you look close enough. Like the idea that if X happens and then Y happens, then X must have caused Y. You can see that all over the place in many different types of misinformation, ranging all the way from disease probably to like the most obscure thing that you could probably think of. There are people who make this kind of immediate leap in logic. And we can sort of identify them if we look really closely, and that helps us to sort of figure out, is this person being legitimate when they spread this opinion, or are they being disingenuous, or are they perhaps misinformed? You can sort of tell if you can kind of identify the underlying, I don't know, I guess you could call it like a misinformation structure, although that sounds a little bit pretentious. But like the underlying kind of misinformation that it is, the way that the misinformation came about. I think as long as you know that, you can sort of address the root of the problem. But anyway, so with all of that being said, it's 4:30, and I think it's time to introduce our guest. So today we are going to be talking to Ormond Derrick, who, to my understanding, helped to basically put together the public health AOC at New College, which is really awesome and very cool. So hi, Ormond, welcome back to Journal Club. Also a former MHI Scholar, by the way, I forgot to mention that. So hi, Ormond, how are you?
Hi, MHI Scholars.